When I was first offered the opportunity to be on a clinical trial, I turned it down. I thought that it meant that that was it, that I didn't have any more options. That had been my only experience with clinical trials, is that it was the end, someone had late stage cancer, they were just kind of experimenting. And I was determined that I was going to beat this cancer, and so a clinical trial wasn't for me. I was originally diagnosed with myelodysplastic syndrome in June of 2010. Subsequent to that, I developed AML. And so now I had a more aggressive form of leukemia, and I was running out of options. I was offered the clinical trial a second time, and I turned it down the second time as well because I still felt like there were no options for me. But then I met these two amazing women, Mary Beth and Karen, and a third lady who kind of floated in from nowhere, Dr. Hokova, and they sat down and they explained the benefits of this trial, that it didn't mean it was over, it was just a new option. It was something that hadn't been considered before. And that if it didn't work, I could always go back to the more conventional ways of doing things. And that is the beginning of a journey that changed my life. I encourage anyone and everyone who has this as an option that they at least explore it. Don't discount it out of pocket. At least explore it, because there are benefits that we have yet to see. We have yet to see all the benefits that would come out. And if no one ever does the clinical trials, how do they ever find cures? And so we're part of the cure. And so I'm excited about being part of something that's going to help someone that I may never ever meet and may never know. But in my heart, I know that I was always a part of it. And so I'm grateful. I think that for the most part, I didn't want to accept what happened. To me, it was unreal. My kids were out of college and starting their own lives, and my husband and I had an empty nest, and we were enjoying life, and I just couldn't imagine that it was happening to me. I'm a woman of great faith. I just knew. I can't even really put in words what you feel when you hear those words. But I think that my faith saw me through. But I think that the really hardest part about the whole diagnosis was in May of 2011. I had developed some issues with my lungs, and they said that at that point there was no more treatment for me. And they gave me 1 year to 2 years to live. And at that time I was planning, my daughter and I were planning her wedding. And all I could think, and I couldn't tell her because her wedding was in a couple months. And so my husband and I held on to that secret. It was something that drew he and I closer together. But it was, I don't think anybody can describe what it feels like to hear those words. I don't even think that the diagnosis itself was as devastating as to hear you have less than 2 years. So that, but because of my clinical trial, I am cancer-free, and I am on to the next chapter in my life, and hopefully that chapter includes grandbabies, Nikki.
We'll make sure she gets it.